There is a big financial loss because of this problem. So, why is it complicated? Why is it hard? So, to start with, just to get confusing, it's got two names for some reason. So it's called Pestivirus. It's also called bovine viral diarrhea virus, or BVDV. And then why it's got virus in the name twice in the second one, I don't know, but it's just trying to make us all confused. It's also a really different way of thinking about disease with this one. So you're generally not looking at this as a sick animal, how do I treat it? You're looking at disease spread through different populations, and over time, so it's different things over years. It does do different things to different animals, so depending on when and what's infected, things will happen. And it causes intermittent problems, so this thing, you might have a problem with it 1 year, the next year you're fine, 2 years later you've got a big problem, the year after that it's a little problem. And also the problems are seen a long time after the infection's been present, so you can have it, it can be gone off the property, and then you're seeing problems with it later on. So, what are the actual problems it causes? So the big one is early term abortions. So you're generally going to see this with poor preg testing, low calving numbers is when you're going to pick it up. It can be, you can lose a calf a year, you could lose half your calves a year, it can be variable how bad it is. The other one you'll get is deformed or sickly calves. So you can see this one, I think, at the top here. This one's real obvious. This is a calf that's been deformed by pesky. More often than not, you'll end up with something like this. So the deformities you see are internal. So this calf here doesn't have formed kidneys, and you go, it looks like a normal calf, it's just every other calf. But 3 months in, 6 months in, it just dies. You go, I don't know why that died. And it turns out, if you look at it hard enough, post-mortem or whatever, you can track this back to the Pestivirus essentially cause. The other one you get is repeatedly sick calves. So these are ones that look normal, but they just get pneumonia, then they get diarrhea, then they get pneumonia again, and it just keeps going in a big circle. So you'll spot this, you'll spot a sick calf, you'll spot low preg testing rates. It's rare that you're going to go all those things. So this is a big one to think about. I'm going to start here because when I talk about deformed sickly calves, think of this, don't think of that, because this is easy to spot. This is one of the problems, the ones that are not obvious. This is my little farm, which I'm going to bring up a few times. That's just for examples. You can see I've got a little house, this is where I live. I've got 16 cows here, 16 cows here, I've got 2 paddocks. So, we're going to talk about different populations of cattle throughout this. And it's based around whether you're infected, whether you're not, and if you're immune or whether you're not. So the first one we're going to talk about is naive cattle. So basically this is cows that have never had Pestivirus. So they're called naive, they've never been exposed to the virus. Then you've got infected cows, and we've got cows that have been infected, clear the infection, become immune. Best example I've got is chickenpox. When you're born, you have chickenpox. I don't know if people still do it, but they have chickenpox parties where you go out, catch it, and you have chickenpox, you're a itchy, so you think, born, nothing, you're itchy, you have it, so that one, and then chickenpox gives you lifelong immunity. Generally, once you've had it, you're not going to get it again. The last one is a persistently infected cows, the other population we'll talk about. I'll talk more about that in a second. So, straightforward. You get a naive cow, which is blue. These colours come up a lot. It gets sick, it has pesky, it's green. It clears the infection, it's purple, and it's got lifelong immunity. So, what happens to a sick cow? Most of the time, really little. 80% of the time, you're going to have no clinical signs at all. If you do get them, they're a bit fevery, they'll have diarrhea, a bit off. Pretty much, no one's really spotting a sick cow with pesky. Clinical signs last a couple of days, generally. and they're so minor that they're just in a panic with everyone else. You're not seeing general a lot of weight loss, you're not seeing too much of these, so they're really overlooked, basically. So we've got naive cow, infected cow, immune cow, PI, which I'll talk about now. This little thing is going to be up in the corner a fair bit when it's important. So, a permanently infected cow. So basically, this is a cow that carries the virus its entire life. It sheds the virus into the environment its entire life as well. So it's generally not, often not overtly sick with it. It doesn't look, sometimes it doesn't look too bad, but they always have it and they always shed it. The virus hides and tries to trick the body into thinking that it's not there, so there's no immune response. The body's not trying to get rid of it. So these cows aren't trying to clear the infection, they're not trying to heal themselves, they just sit there, shed all the time. So how do you get a permanently infected cow? It's one of two ways. Most common is this one here. You get a naive cow that's pregnant, and it's pregnant at a very specific time, so it's 40 to 125 days pregnant. The virus goes into it, infects it, and a PI calf will come out. This is rarer, but you can get a PI cow that gives birth to a PI calf. So what do they look like? They're often skinny, they're often your worst cows, so the ones that are sort of at the back of the herd that are just never catching up. They have, they're sometimes not, sometimes they just look like normal cows and they're really tricky. They're unlikely to breed, so even though you can get a PI cow to make a PI calf, it's uncommon. Most of them just die because essentially the virus suppresses their immune system enough, or they're born with deformities that they just don't make it to that year. So, have I lost anyone yet? Everyone's got the idea of what an infected cow is, what a PI is. So these ones are not super important, but we better cover them. How do they catch it? They catch it just in everything. So cows kissing each other, it's spreading feces, it's spreading urine, it's spreading semen, milk, just every orifice that a cow has, it will share this virus. So this is how cow to cow, just any possible way you can think of, it will spread. And then this one's only interested in PIs, is cows spreading to a calf. And then how's it get onto your property? So the most common one, and the one we're really concerned about, is if you're buying in cattle. So if you don't buy in, if you've got a herd that is, if you've got a herd that you're not buying things in, you're going to have less problems. You can get across a fence, so this is if your cows are leaning over the fence, kissing the other cows, they're pooing. The other big one is this is people travelling around, so the reps, trucks go from farm to farm, and they can bring things, poo and all sorts of bits and pieces across. If people do bring it in, it's not so much a problem. The main one is just buying things in. So, this is my first little example. This is my little farm, and one day this cow in the corner over here dies. So I go out to some yards, I buy a new cow. It turns out it's a PI, look like every other cow, I didn't realise I was buying this, but I've got it. So it starts infecting cows. These cows start getting sick, and it works its way through the herd. And then a bit of time passes, a couple of weeks, get another one, and then they all clear the infection, they all become immune. So the big thing with this is all this has happened. I've got rid of that cow just because it helps me explain it for a second. All this has happened, we've got this disease outbreak on your property. The big thing is, you know, what would have you actually physically seen on your property, looking at your cows and checking everything? The big thing for this, you would have seen anything. So most of these cows are non-clinical. If they are, they're so mildly affected that you're not really concerned about it. So you've had this big change, you've gone from this big naive herd to this big immune herd, and you generally notice nothing because there's not the signs that anything's going on. The other question is, why don't these ones get sick? This one is all related to how infectious certain diseases are. So, imagine if I have the flu right now, you think everyone here is probably going to get infected with it, whereas the people down the back are less likely to. And then you've got the inherent pathogenicity, so how aggressive a virus is. So if you've got one that's really aggressive, you know, maybe I'll get further, infect half the room and not the rest of the room. So just because you've got a sick animal in a room with another sick animal doesn't mean every single thing is going to get infected straight away. So with this is a little value from R0 value. And it's basically a measurement of how infectious certain diseases are. And pretty much every disease, they've all got a number. You can see COVID, this is just an example, everyone had it, is number 3. An infected cow, so a green one, is 0.25. The lower the number, the less infectious. So those green cows are not particularly infectious. We'll talk about this a bit more, but it's essentially where we're going there, where they're all spreading through, they're all turning green. You've got these relatively non-infectious cows around that. Pregnancies, this is where it gets more complicated. So this is a naive cow that's pregnant. This means she's just never been exposed to the virus in her life. The consequences of what's going to happen in this situation when she gets it depends on at what point in gestation that little calf is. So, if she is 0 to 40 days pregnant, she's going to abort that calf. It's an early term abortion, so you're generally not going to see fetus coming out of it. She's just essentially going to turn from a pregnant cow to a non-pregnant cow. Everything that's inside is just going to be absorbed. As we mentioned before, if you're day 40 to 125, she'll produce a PI. If she's 100 to 150 days, she'll produce everything. Sometimes it'll be a PI, sometimes it won't be a PI, sometimes they're deformed, and that can be visually deformed, internally deformed, whatever. And then the last one, if she's late pregnant, you're just going to produce generally a normal calf. So, back to this slide. Why is it complicated? It's because it's doing different things with different animals depending on when and what animal's infected. So, if we're a healthy cow, we're just a bit sick for a couple of days. If we're pregnant, depends when we're pregnant, that's what we're going to make. So, here's my next example. So, as you can see, this is a farm again. Everyone's pregnant, and everyone got pregnant on the same day, from my example. And this is early pregnancy, so all these cows are early pregnant. So PI jumps the fence and infects this cow, and then jumps over here, infects that cow, and then it hangs around. So a bit of time passes, this one aborts, and this infection starts spreading. G clears the infection, she's now empty, and then on this side, the infection keeps spreading, so we've got a couple more abortions, a couple more sick cows. Time passes a bit, so we've progressed on. So these girls are aborted, these girls are newly infected, so they start producing PIs. We're a bit further along, so this one's only just got infected. These girls clear the infection with their little PIs. We get a little deformed calf in there. She clears it, we get another infection, another deformed calf, the PI racks off, that's the neighbours. This cow gets infected, but because we're now late pregnancy, she just keeps that calf. So you see all these different things that happened over here, not much happened over here, but we've got all these sort of different cows and different scenarios now. So pick one again. If you're just sitting in your house just watching these cows, what did you see? So basically everyone's calved, you're going 93% of this paddock calved and 56% of this paddock calved. And you go, that's a big difference. And you go, there's only 16 to 16, but if you're doing 200 to 200, that's a big difference. In this one, you go, there might be 2 deformed calves, they might look normal, but really you're just going, okay, got it crap, carving this paddock. And then you're going to ask yourself, why did it happen? And you're going to go, was it bad bull in that paddock? Yeah, it was poor management, but skinny, it was a bad time of year. Is it some nutritional deficiency? And then you go, well, where's the pesties? Another one that in mind. But you sort of see, you can definitely see this. This is really obvious that you've got bad calving in this paddock. Why you have bad calving? It's a tough question. So, this one, basically your problem's going to be seen a long time after infection. So you're just seeing calves. By the time you're seeing calves, the virus is gone. It's not on there anymore. You've got nothing shedding. You're seeing the problems months after there actually has been a problem. So, when you're going to really notice this, you're going to see these sick calves, you're going to see poor preg testing rates. They can both due to other factors. The only way you're ever going to know is to do some testing. Testing's pretty easy. I'm sure most of you guys have done these. There's little ear notches. They look like little COVID tests that we're pretty used to. Basically, you can have a little chunk out of your ear, run through this little thing, and it'll tell you whether you've got a PI or not a PI. You can determine between a naive cow and an infected cow. Immune cow. This is just a blood test. You can also diagnose infected cows. You need 2 blood tests 2 weeks apart. Practically, we're really never going to be doing this with you guys. This is mostly for research, things like that, because if you have an active infection, the gist of you trying to actually spot that, it's just so minimal that it's never really practical. There's also no treatment for an active infection, so you can pick it up and go, oh yeah, there is an active infection on my farm. We can't really do anything about it. So, here's my next example. So, we had that bad year, we lost all these calves on this side, we've battled through like we always do. And then it comes to sales, so I started selling some cows, I sell some cows, get some replacements, year passes, I sell some more, get some new ones, I sell some more, get some new ones. Basically, years sort of come along, sell these cows, these replacement cows, and end up with the farm starting to look like this. So, what's happened here? Basically, we've gone from a herd that is highly immune, which is good because immunity means we're not susceptible to having really bad years with lots of abortions, to a property that's mostly naive. And so if we bought a new PI again at the wrong time, everyone's pregnant, we're going to have another bad year of calving. So the other thing is, again, like what have you seen over these years? You haven't seen anything, because a immune cow and a non-immune cow look identical. So this is the other one. Because this seems to be a problem to go, we started back 2004, when I saw the first slide, it was 2023, that's 2030 in that last slide. And then if you have another problem there, you go, well, I have that problem for 6 years, why is it popping up now? That's because you've had this thing that's been suddenly occurring behind the scenes without you realising. It's then you probe to another issue at that point. So, back onto our little infection. So, the green cow, the infected rate, so infectivity of that is 0.25, so it's not very infectious. PI, basically, our order of that is infinity. So, all this is really saying is that if you have a PI on your property, in with the other cows, it's 100% chance it is going to infect every cow it has the opportunity to, given enough time, essentially. So, infected cows, not so much a problem. PIs, a big problem. So, this is an example of that. I sell these cows, I buy some new ones. This paddock, unfortunately, gets another PI. This one just gets an infected cow. So, as it does, it starts spreading. These ones spread, these ones spread. So, this is 4, but it sort of stops in this one. These ones, you have these two, they're both immune. The infection doesn't get too much more. Whereas on the other side, everyone's infected, everyone starts getting immune. And then, as I said, give it enough time, so a year passes, and this PI is still here, still shedding, it starts infecting everyone else. So you end up with everyone infected on that side, not everyone infected on that side. Right, how do we stop it? So basically we've got three tools that we can use. First one is vaccines. Second one, biosecurity, so stopping PIs coming to property. And then the last one is we can identify blue versus purple versus red, all those bits and pieces. So this is probably a big one I always struggle with everyone, is we're very good at testing, vaccinating, but we always struggle to find out what we're trying to achieve, which often is probably a big breakdown in trying to get what we want out of it. So it's sort of important to have an idea of which goal we want to start with, and there's sort of four basic ones. First one, which is essentially the best one, is have a fully vaccinated herd with no PIs. The second one, so this is going to involve trying to find the PIs. The second one is just vaccinate everything and ignore the PIs. Last one, you can get rid of all the PIs and have a closed herd, so you essentially run as a naive herd. And the fourth one, you can use the PI as a vaccinator. This one I don't really recommend. I'll talk about it because it is a thing, or some people know about it. So I'll talk about why that's fine. I'm not going to talk too much about the vaccine, but basically it's simple, similar to most other vaccines. I think it's 2 in the first year, 1 every year after that. Yeah. It costs money, is probably its biggest negative. But it's a good vaccine, it does a good job. So this is the big one. Why are we getting rid of the PIs before the cattle are vaccinated? And it's because no matter what vaccine you have, there's always flaws in them. There's always things, ways diseases will get around vaccines and still cause problems. So the biggest ones tend to be user error. So if you're giving it incorrectly, if you get a whole mob in and one gets through the crush or jumps a fence and you can't be bothered getting it back in, which is fair enough. Equipment malfunction or gun doesn't work. The other ones is on the cow side of things. So a cow that's got some other sickness, you're going to have a reduced immune system. Any stress you put them through will drop their immune system. Travel's a big one. If you put a PI in a vaccinated cow on a truck and ship them far enough, the vaccinated cows still got infected from that PI. So there's going to be times when, even though you've done everything, doing everything right, there's going to be little holes in there. And then as we know, if you've got a PI, it will infect everything it has the opportunity to. So if a cow's stressed, has a reduced immune system for 2 days, there's a PI sitting there next to her, catch it. It won't make the cow sick as always, but if it's pregnant at that time, it can then produce another PI, and then you end up with around. I know there's a property I was at a while ago, and they've been vaccinated for 10 years or something like that, and I've diagnosed 2 PIs in the last 2 years, and they don't know where they're getting them. There's something under the covers, under the rug that they're not seeing there, basically. So the next one, you can get a closed herd. So this is basically identify all the PIs, and you get rid of them. And you run a herd that just has no exposure. I suppose the benefit of this is you're not having to vaccinate, which is saving you money. The negatives of this is that you are susceptible to an outbreak, essentially. So where that comes from, there's plenty of places it can. It can be viable this if you're not ever buying cattle in. If you're buying cattle in, you need to ear-notch every single thing that comes onto your property to make sure it's not a PI before it arrives. So it's a reasonable way to go. It just has a little bit of risk associated with it. So this is on the last option. Basically, when does pesty not cause a problem? Basically, it comes down to when nothing's pregnant. So if you've got just all steers, you don't really need to worry about it because you're not going to get PI, you're not going to get abortions in steers. The clinical disease is generally not too concerning. An empty cow, same thing, you can, it's not the biggest stress in an empty cow. They're not too concerned. And then if they do have it, it's a good thing, at least this lifelong immunity, which is something we want. So basically the protocol for this is you find a PI, you put it in with your cows post-calving for a couple of months. Then the idea is that PI infects all the animals, you shouldn't see much clinical disease, and then they end up with. Why I don't like this is basically you've got no idea of who got infected and how many. Was it 20%? Was it 80%? Was it whatever? So generally to check this out, you need to then run all these blood tests on the cows to find out what level of immunity you've achieved. If you've got a good amount, you don't need to vaccinate. If you've got a bad amount, you do need to vaccinate. With all this, you're generally not achieving a huge amount of cost or work savings. That's what you're sort of after. The other one, it's not really exactly sick PI, they're pretty sickly, uncomfortable cattle. So, what are you going to see with these if we choose each? So if you vaccinate with no PI, good biosecurity, you're not going to have a problem. You're pretty much foolproof on that one. If you vaccinate, ignore your PIs, this isn't a bad option. I'm not trying to, it's second best of that, but it's all right. Maybe you'll get an occasional PI on your property, and that animal's going to be a sick calf, and you're going to have to give some antibiotics to, and cause you a little bit of stress. You might lose a couple of early-term abortions, but you shouldn't get any big outbreaks, so you're not going to get like 50%. Maybe you'll drop 1 or 2%. Biosecurity with no PI. Again, you should be seeing nothing with this. So this should be pretty foolproof. You just got that risk of a biosecurity breakdown, and then for this, it's a bit variable whether that happens because there's so many factors in that option. So, this is my little bit about me. This is sort of how I can help if we're starting vaccines or things. So, the idea is if you've got this farm, it's my farm at the end, all these cows are naive. So, we want to vaccinate all these. We don't want to vaccinate all these because they've all got lifelong immunity. We want to ear notch all these to find that PI and get rid of it. We don't want to ear notch these ones because it's less money and time. So look, there's efficient ways to do this, which I can talk to you about personally if that's something you're interested in. And then here's a big one. Like it's losing your money is the big reason that we're here. You're losing money with abortions. You're getting more neonatal death. Any PIs are fine to killing. It's costing you money too. These PI calves are a real pain because they get sick, they get pneumonia, you treat pneumonia, they get better, and then a couple of weeks later they get diarrhea, and you treat that. A couple of weeks later they get pneumonia again, and you're putting in lots of money, lots of time trying to save these things they're just never going to live. So if you don't have to deal with that, it's a great option. That's all, yeah. Any questions? Yes.
What's step one? You notch them all?
Now step one, basically we take we get about 5% of each mob and we blood test them and we look for a percentage of immunity. So basically what I go here, let's blood test this cow, this cow, this cow, and that'll come back as 100% immunity. Test that cow, that cow, and that cow, and that'll come back as no immunity. So I'd say there's got to be a PI here somewhere, and there's no PI there somewhere. And then we'll go, let's ear notch all them. Okay, let's vaccinate all these.
Well, I'm thinking if I've got 50 on panic and you're doing 5%.
Yeah. If you've got 50, you probably just ear notch them. If they're all running together, so if you didn't have two paddocks, if you just have one giant paddock, you're just going to ear notch them.
So, setting up a vaccination program.
Yes.
Timing on
When to do it. Andrew is going to run through that. I think he's got on that one.
In the ear notch test, is that something that you can't do yourselves, or have you do that?
Basically, you can collect them yourselves. We've got a little like a hole punch, and you've got a disinfectant and stuff. And so basically, you do that, take a hole punch, put it in a little thing, and you drop to us, and there's a place over in Queensland, WA, and they do bulk lots of it. And so the more you do, the cheaper it is. So you're collecting the samples is pretty straightforward. It's just a whole bunch.
So is there a time sensitivity between collecting a sample and then getting it off for it to be tested?
It's really robust. You can do it on an animal's for 2 months. If you've got a bit of skin, it'll work. Yeah, is that everyone?
Felix, I tested I tested both cattle in.
Yeah.
Come back positive. I kept them for another 4 weeks. Retested, they come back negative. I was told it was a false positive. What's that?
Yeah, that's basically lab errors, maybe call them. So all these tests, doesn't matter what tests you're doing at any disease, there's a certain amount of basically crossover with different things. So a simple way to explain it is if you use a hole punch to take a ear notch and then straight away a hole punch in another animal, because you've got a little bit of blood from the first one, you put it on the second one, come up positive. So there's a lot of cross-reactivity and different ways that things can come up positive and negative when they're not really true. In general, none of them are, there's no test I've ever run that's 100%. The pesty one, it is a pretty robust one. You're going to get it right most of the time. The times you won't, the biggest time you can have a problem with it is that crossing over with another animal. So if you're not clean between your animals, you'll end up with, you'll touch a PI one and then you'll get the next 2 will be PIs because you still got some contamination. But there's plenty of other reasons that they don't work. But in general, yeah, it's a pretty good test. It's mostly, it's just different ways to do it. I both are fine.
We do the tissue as part of the genomic sampling. So when we're doing genomic sampling, we can use the tissue sample at the same time. And just if it does test positive, we would run another test to confirm a PI.
Basically, the PI test, all it wants is skin. It doesn't have to be just any skin, any on the body. We're looking for epithelial cells, so with your hair, it's the same sort of thing. You're just getting epithelial cells in the hair.
If you ship them and you've got a PI, or can it be a cow that's just been infected?
Say that again.
You've got a cow, you can chip it, and you